How you doing, my friends? Welcome back to the H-Man podcast. Today, I'm discussing concussion. It's a very, very interesting topic. There is more awareness about concussion nowadays, much more than before, and you can see that if you follow sports. Concussion is a big topic. There's more precautions are taken. Players are not let back if there's a suspicion of concussion. Without further ado, let's get started. I want to talk a little bit about this presentation. You can call it podcast. So the objectives of this is to learn that concussion is a serious injury with long-lasting signs and symptoms. And concussion is more common than we know, and it's usually underdiagnosed and untreated because, for a simple reason, which is point number three, it cannot be diagnosed by MRI or CT scan. So MRI or CT scan won't discover or detect a structural damage to the brain. So therefore, like it's goes undiagnosed so many times. However, there is a clinical assessment for it, and that's what we're going to discuss today. So when you screen systems will lead to proper diagnosing of concussion and the type of concussion, because there are so many types. So basically, what we are screening the function of the brain and the affected areas. Okay, so if the function of the brain is impaired, that's when we're able to make a diagnosis to the concussion. And we're not just talking about the brain; we're going to talk about a little bit of the peripheral nervous system as well that gets affected by concussion. Proper diagnosing of concussion will lead to shortening of recovery, thus direct the patient to proper rehab and recovery protocol. So if we're able to detect concussion, we're able to prescribe the treatment protocol for it, and therefore it won't take many, many weeks like it does in many, many cases because it's just left untreated. And when you leave it untreated, you're basically creating an irritation to these systems, and these systems flare up again, and then you're stuck in this vicious cycle of concussion, and then you have chronic concussion symptoms. So, what will we discuss today is we're going to learn what's the definition of the concussion, systems affected by concussion, symptoms, diagnosis, intervention, and rehab and recovery. Okay. So, and lastly, how to get in touch with us because we are launching a virtual treatment and virtual screening service to help athletes and normal people who sustain concussion or suspect that they have concussion or they are never been the same since their trauma. They can get in touch with us and we can help them, direct them to the right direction, help them to understand what's going on. Without further ado, let's get started. Before we start, the quote of the day: the pessimist sees difficulty in every opportunity. The optimist sees opportunity in every difficulty. Winston Churchill. So take the chance after you face difficult circumstances to come back stronger. Acknowledge the fact that you are not the same. Things changed. Now you have opportunity to improve and to move forward in life, learn more, and this way you create opportunity out of difficulty. Versus like you say everything was well, I don't know where this came from, and prolong the grieving process. Instead, seek the help that you need. And I'm talking about life in general. You just need to acknowledge that things change all the time. And when you face difficulty, it's actually an opportunity for you to change, learn, and grow. And sometimes you can't do that by yourself. You would need a help from others, more experienced professionals who know exactly what they're dealing with because they're not just dealing with you. They have dealt with people like you for just for living. Basically, that's what they do for a living. So therefore, like, it's always good to acknowledge there is a problem and then move forward from there. Okay, so now we back to concussion. So we want to learn a little bit about the disease. It's a mild traumatic brain injury. Okay, concussion is diagnosed when a head injury occurs through enough force plus the presence of specific symptoms. And we're going to discuss these specific symptoms. There is no structural brain damage. Therefore, you cannot detect it with MRI or CT scan. So there is no diagnostic scan or diagnostic study you can do for it just by imaging or something like that. That is not existent in concussion. Okay, the force that causes concussion is milder than the force that causes whiplash injury. So imagine everyone goes through a car accident and they get a whiplash diagnosed with a whiplash injury. 99% of the time they also have concussion and it's left untreated. And I've seen that in practice. I had with this lady coming to practice. She was doing physical therapy. So basically, what they were treating her was treating her for cervical spine dysfunction or disc herniation, but no one actually screened her for symptoms of concussion. And then when I did that, we were able to detect existence of concussion. And next, like after that visit, when I diagnosed her, she came back and she told me her best friend told her, "Yes, I knew something was wrong with you. You were forgetful. Something is wrong with your memory." And she weren't able to detect that, but she felt like something is abnormal with her, but she couldn't really put her finger on it. Even her social circle noticed something is wrong with her, and it was left untreated until someone who is aware of this problem was able to take a look at it. Okay, so whiplash causes concussion. Okay, so you can't just treat the neck problem, you have to treat the concussion also. Okay, the CDC estimates 1.6 to 3.8 million concussions in sports and recreational activity per year. So 1.6 to 3.8 million people get concussed uh, during sports per year, and over 40,000 in each emergency department visits related to concussion, to sports concussion. So sports concussion can actually fill an ER with 40,000 people per year. And actually, more than 12 folds of non-sports related concussions are also referred to ER. So you can actually understand the magnitude of this condition. And non-sports related reasons could be like motor vehicle accident, falls, and etc. So the pathophysiology of concussion, like what exactly happens to the brain. So there's a stretching of neuronal and axonal membranes, deregulation of homeostasis. So there is a homeostasis effect or homeostasis uh, state of the brain, and that gets interrupted by the stretching of neuronal and axonal membranes. And these are basically nerve cells. So nerve cells get stretched due to the movement, the coup or counter coup movement of the brain within the skull. And that means basically just movement of the brain. There is a change in glucose metabolism and increased oxygen demand and decreased cerebral blood flow. So the energy supply of the brain changes, as well as the oxygen demand increases in that moment because the brain needs to heal. And there is also, this is also associated with cerebral blood flow. Cerebral means the brain. So there's brain related, like brain blood supply to the brain has decreased post concussion. Okay, so what are the symptoms? So 93% of people having concussion have headaches. 75 percent have dizziness or unsteadiness. Concentration also gets affected by 56%, confusion 45%, vision problems or light sensitivity can be 37%, and then lastly we get migraine and balance challenges. So there can be overlap between any of these symptoms, and that's why the total of uh, how often this can occur is not 100% because most people get headaches in addition to dizziness, to concentration problems, confusion, light sensitivity. You can have all of these if someone have a concussion. So systems impacted by concussion are the vestibular system, which causes vertigo. A lot of people are aware of what's vertigo. It's basically feeling dizzy. It's the same sensation happens when someone gets drunk with alcohol. That is vertigo. So vestibular system can be affected, and it manifests itself into vertigo. Ocular system, so the eye movement, also can be affected. Cervical spine, and sometimes that's associated with fracture because there is a trauma, there's an impact. Cognitive abilities, including memory and concentration. Neurological effect, like headaches and migraine. Psychological, which is mood and anxiety, and also is associated with fatigue. So those are the symptoms impacted by concussion. And we're going to screen one system at a time when clinically to identify which system is affected, or sometimes more than one system is affected. So vestibular system. So the vestibular system maintains balance, spatial orientation, and stabilizing images during head movement. So if you are having your eyes closed and you're hanging upside down, I hope you don't have that experience at all. But how does the body detect that you are upside down? Is because of the vestibular system. It does not need a visual input to know what's your body position. You know your body position just by feeling where you are, and that is the function of vestibular system. Okay, so if vestibular system get affected, we say it gets you get a symptom of vertigo. So the intervention in this case will be assessment of canal involved, followed by repositioning maneuver. And the most famous one is Epley maneuver. A lot of people know what's Epley maneuver. It's basically using gravity to dislodge some crystals that is stuck into the inner ear and causing uh, abnormal stimulation of the vestibular canal, which causing sense of dizziness, and that is gravity dependent. So vertigo is not a constant symptom. Usually people feel it when they change position, when they get up in the morning, and it lasts from just to 30 seconds, no longer than that. Sometimes it lasts longer, and it's also related to the vestibular, and that's why the assessment comes in handy to detect which canal is affected and what is um, the right treatment protocol for which canal that is affected. And again, the treatment is just simple. We use repositioning maneuver. Changing the body position is basically having someone lying on their back, turning their head and turn their body, and so on. And that helps to dislodge this crystal out of the canal and then gets the symptom cleared. How many sessions does this needs? That takes maybe 1 or 2 sessions, maximum 3 sessions, to treat a vertigo, even if it's just a vertigo that happened without any cause. And that happens all the time with healthy individuals. So we screen the vestibular canal. Next, we screen the ocular system, so which is responsible for vision acuity, convergence, and divergence. So basically, if you look around you, you see everything in one picture. That is convergence. Divergence is when something is close to your eyes. Now you see it in two pictures. Okay, so if you bring your finger close to your nose, you see it as two pictures. When you move it far from your nose, you see it as one picture. That is convergence and divergence, and that is the ocular nerve and ocular system is responsible for it. So what's the intervention? We in clinical assessment we assess the ocular function, uh, followed by retraining of ocular function through series of eye-head coordination exercises, and sometimes also a referral is required to an ophthalmologist to check the visual acuity. And sometimes someone who wears glasses, maybe they will need to change glasses post concussion, which is, I know it's hard to imagine, but it is true. It happens. Someone gets ocular dysfunction, they might need to see ophthalmologist to change their eyewear prescription. Cervical spine. So the cervical spine is quite simple. It's the neck. Uh, what does the cervical spine do? Is basically the area that protects the spinal cord, blood supply to the brain, innervation to the upper extremities, like connects the nervous system, the central nervous system with your arms, so you can move your arms, stability of the head and muscle attachment. So there is muscle attached to the neck, obviously. So the intervention is clinical assessment of cervical function. We make sure that the dizziness is not originating because of blood supply dysfunction or an occlusion or narrowing of the blood, uh, the arteries, the vestibular, particularly the vestibular basilar artery. So we screen that in clinic to see if there is any dizziness associated with a movement, which is basically rotation of the head and an extension. So looking to one side and then moving the head backwards. And we hold that position for some time and then see if the patient has lightheadedness. And in that case, actually, you can differentiate it from vertigo. So vertigo can be caused by vestibular system. This is caused by blood supply, and they can be completely different from each other. And that's why screening is important. And this is a serious condition. We rarely see it in clinic, but I always screen anyone with neck pain or post accident for VBI, vestibular basilar insufficiency. Okay. Also, headaches, increased muscle tension in the shoulder, like in the trigger points, can also cause headaches. And that headache pattern is completely different than migraines. And therefore, also, we need to differentiate whether the headaches are migraine originating or uh, originating from the cervical spine musculature, from the muscles around the neck. The treatment will be postural retraining, so we try to help patients to uh, strengthen their stability muscles in their neck through gradual exercise program. Also, manual therapy is key to treat trigger point pain. So trigger points are the knots, the tension points in the shoulders or around the neck or just below the occipital area. And And that's it for the cervical spine. Moving on to the cognitive system. So the cognitive system is attention, memory, learning, problem solving, and decision making. And we screen that through questionnaires to see if the patient is fully competent with their cognitive system. Intervention: the patient is screened through a questionnaire to determine presence of cognitive difficulties. Rest is very key to heal from concussion. So 10 to 12 hours per day is recommended to rest, whether you sleep or not, but it's important to rest. Aerobic exercise, subthreshold heart rate exercise. So aerobic exercise is key for recovery from concussion. And if you remember, we discussed in the beginning that there is a deregulation of homeostasis and lack of blood flow to the cerebrum, to the brain. And aerobic exercise helps to increase blood flow to the brain. So how can we determine how much exercise can you do per day? And that is determined through an exertional test. We have our subject on the treadmill or a bike, and we take their heart rate, and then we increase the intensity of the exercise, whether through speed or resistance. And while monitoring the heart rate, just before they start, let's say they start feeling dizzy or headaches at heart rate 100. So we will adjust the exercise 15 minutes per day or 20 minutes per day aerobic exercise at 90 beats per minute heart rate. So the intensity is based on the heart rate, and we want to keep the intensity sub threshold to the symptoms. So just before the symptoms uh, arises or appears with the exertion, we put the exercise just below that, and that's the level. And then this is actually a key treatment for concussion, and that's why a professional is needed to help you test what's your exertional level, when do you feel the symptoms, and develop an aerobic exercise program based on your individual symptoms and your heart rate. It's important to limit the screen time to 15 minutes per day, then gradual increase. So if you are working using computer or studying, it's important that you refrain from using screen because that also is affecting the healing of your brain. Academic modification. Also, if someone is in school, someone in high school, mid school, we also help them through four-stage recovery or return to studying uh, through it's called academic modification. So it's important that we basically schedule your studying in a gradual way so it does not overwhelm your brain and affect the healing, because the more you use your brain while it's still healing, it delays the healing because there is a trauma that happened. It's the same when you're having, like, you have a sports injury, you need to take a break. Same thing with the brain. The brain needs a break. Headaches and migraine. So the difference between headaches and the headaches that comes from the neck is completely different from the migraine. And the migraine has like constitutional signs and symptoms, which is unilateral pulsatile headaches accompanied with nausea, vomiting, light sensitivity, photophobia, and sound sensitivity, which is photophonia. Sorry, phonophobia. Okay, so those, if someone has a headache on one side, pulsatile with light sensitivity, that's is migraine. It is not the same headache that comes from tension headache or trigger point related headache, and that those two needs to be differentiated, and that can be overlap also between both. So that is something needs to be screened. So the treatment also involves manual therapy. We try to treat the trigger points to relieve the pain and the tension coming from the muscles, and because that also has an effect on the migraine. However, it's not the cause. That's why it's important to be seen by a neurologist, sometimes an endocrinal doctor, to treat the headache disorder. Okay, and that requires a physician specialist to treat this problem. Psychological. So there is also depression and anxiety. So the changes in neurotransmitter levels and neural circuits involved in mood regulation. Recovery can also cause isolation and exacerbation of mood disorders. So if someone is already having a mood disorder, recovery, like, because you get isolated because you have to rest, your social life and work life is interrupted by this. So it can actually cause depression and anxiety. However, it can be also caused by the trauma. It's not just based on like you're not going out enough and you're not engaging with the life, with engaging with life the same way you were. No, it is because of changes in neurotransmitter levels, and that is why it's important to continue the aerobic exercise, because we need to send that blood flow to the brain and help it heal while maintaining adequate times of rest. So patient is screened via indexed surveys to determine existence or potential risk of posing psychological effect. So we screen the patients through questionnaires, exercise prescription, submaximal, subthreshold, heart rate not above or at the level of symptoms. When the symptoms arise, we keep the heart rate low and continue the aerobic exercise I just described. Maintain social engagement, so we encourage patients not to isolate and talk to their loved ones and friends. Mental health counseling, and that is specialty the of psychologists or psychiatrists. Cognitive behavior therapy. Sometimes also you need a behavior therapist to overcome that, and that can actually show you how impactful to the health concussion can be. Now, fatigue. Fatigue is due to brain neurological changes, sleep disturbance, cognitive overload, psychological factors due to coping with concussion or homeostasis disturbance. Many reasons can cause fatigue. Intervention, again, graded heart rate exertional testing, and then we do perform the aerobic protocol to aid in recovery. Improve sleep hygiene. Also, there is neurologist or endocrinologist involved in this process to help the patient recover. However, if the patient never got screened, they will never go to the endocrinologist or the neurologist, and that's why this is important. Now, lastly, Theracave Physical Therapy offers telehealth for post-concussion victims. Anyone who sustained concussion can benefit from telehealth, basically a virtual consultation. So telehealth, video screening of systems involved via intakes, index questionnaire, guided physical assessments, assess red flags, and refer patients immediately to specialists. So again, we won't be able to say if you have concussion or not, or at least suspect that there is a presence of concussion without doing these screenings because you did the MRI and CT scan and nothing showed, but you're still having fatigue, you still have headaches, you still have dizziness. How would you treat that? That is through screening. So first, you have to identify the problem to treat the problem. Intervention is going to be vestibular rehab through video guided positional maneuvers. So we can treat the vertigo through um, guided positional maneuvers. So we help the patient. We show them videos of which canal we're going to target with the positional maneuvers. We explain it thoroughly through the video call, and we see some success with that. Screening of cervical spine range of motion. So we check the neck range of motion and strength to identify if there is a cervical component, neck spine component to this problem. Rehab protocols with follow ups for affected systems. So we also uh, develop rehab protocols, for example, for the ocular system, the vertigo system, and finally, which is the most important, which is the rehabilitation part of uh, of the concussion is individualized aerobic exercise implementation. And how would you know when can I go back to playing tennis or football or whatever you or start at least jogging is through individualized exercise implementation based on your symptoms and your heart rate. Lastly, our office is located in uh, beautiful downtown of Fort Lauderdale. We are taking appointments uh, 9 to 7 every day. And we have our email and phone number. And please feel free to reach out to me. Send me an email with a question. Give us a call. We also provide 10 minutes consults for free to talk and understand your condition and give you the best advice. And until next time, have a great day.